or exercise or food. The governor of Illinois said this was an extremely tough decision to reach.
If there are actions that I can take that will save lives in the midst of this pandemic, no matter how difficult, then I have an obligation to take these actions.
Testing of Americans has ramped up dramatically, more than 200,000 tests being performed. That's up 800% in just 1 week. Still concerns, though, over shortages of protective equipment for medical personnel, being asked to reuse at times disposable items. Some medical personnel even saying they've been asked to make their own masks.
We have to get through this period of time where demand is outstripping supply.
On Friday, the Air Force brought home 89 Americans from Honduras, a number of Americans in different countries around the world suddenly caught with borders closed and flights canceled. Arthel, back to you.
Steve Harrigan, thank you very much. Eric?
Well, Arthel, Times Square, much of New York City, resembles, as you said, a ghost town these days, especially after Governor Andrew Cuomo stepped up his safety mandates. He ordered all non-essential employees in this state to stay home. This all in an effort, of course, to stop the spread of the virus. But the governor did not downplay the potential danger.
That at the end of the day, 40% to 80% of the population is going to be infected. If you look at the 40 to 80%, that means between 7.8 million and 15 million New Yorkers will be affected at the end of the day.
The governor saying it is the role of the government and public authorities to protect us. Alex Hogan live in New York City, here in Manhattan with more. Alex?
Eric, there is a statewide shortage of medical equipment, so the governor announcing that there will be 4 new field hospitals, essentially, that will go up. One of them here is this convention center, the Javits Center, that could house up to 1,000 extra beds. And meantime, across the state, new rules going into effect for New York. Starting tomorrow at 8 p.m. on Sunday, police will start enforcing social distancing in all public places, and everyone deemed not essential must stay home. The only people deemed essential in those fields of work are healthcare, law enforcement and security, manufacturing and retail of goods like food and pharmaceuticals, journalism, construction and infrastructure, shelters and childcare facilities, and finance. Starting tonight in New Jersey, nearly all residents will need to stay home. That's after Governor Phil Murphy's new executive order. Connecticut and Pennsylvania issuing similar measures that are closing other non-essential businesses. In Vermont, the governor there closing all close contact businesses, meaning gyms, tattoo parlors, and that goes into effect by Monday at 8 p.m. Nurses this morning at Mount Sinai, New York City, being told that they are officially out of masks. New York has more cases than any other state, with 10,000 positive cases. That is an increase of 3,000 in the last day. But to put that in perspective, so far the state has issued more than 45,000 tests.
The more tests you take, the more positives you will find. We are taking more tests in New York than any place else. We're taking more tests per capita than China or South Korea.
And of all of the cases in New York that are testing positive, the governor noting that 15% of them do need to be hospitalized. So again, this is just one of the centers that will open up. And of course, we're seeing a massive economic impact on all the businesses across the city and state that have closed. But the governor saying that we need to focus on healthcare first and focus on that next. Eric, Arthel?
Yeah, and the governor also praising all the people who work for government, the bus drivers, subway motormen, and the doctors and nurses, especially on the front lines. They are heroes, and they are. Alex, thank you. Arthel?
Yep, in fact, all across our nation. Meanwhile, Vice President Mike Pence is saying that he and his wife will be tested for the novel coronavirus later today. This after one of his staffers tested positive, even though the president said that he did not come in direct contact with that staffer, saying that at the briefing earlier today. Meanwhile, federal health officials saying a short time ago that they expect the number of cases to rise here in the U.S. as they plan to ramp up testing. Let's go to Mark Meredith. He's live at the White House with the details on that. Mark?
Arthel, the White House says it is seeing a widespread infection when it comes to the coronavirus. That's why they continue to urge all Americans to really use those best practices to slow the spread that they've been talking about for the last several days, whether it be you're sick, to stay home, and of course, if you have those underlying conditions and feel sick, then to go get tested. But they've wanted to make it clear that they are seeing the amount of tests ramp up. However, they say not every American should go get tested right now, only those that would fit the criteria that the White House has been talking about. As you were just hearing from the previous reports, there have been so many questions about the medical supplies that are out there and whether there are enough to help those hospitals that are going to be dealing with these outbreaks, not just today and tomorrow, but from weeks to come. The administration announcing that they have placed a new order for the Department of Health and Human Services for millions of masks, those N95, to help healthcare responders, but admits that that is going to take some time for them to get to those hospitals. The administration also facing questions about what comes next when it comes to these states that are limiting people from going out, whether they're not essential or not, or basically told to shelter in place like we've seen in California, New York, and a few other states. We asked the president about that moments ago during the briefing. Here's what he had to say.
And you can't put on them what you're putting in New York, where you do have a tremendous problem. I mean, we have large portions of the country, middle America, where, you know, they have a few people. So it may be a time, I hope that never happens, where we need to take very drastic action. But right now, that's not in the same ballpark.
The administration says it's working with America's governors to make sure they have the resources that they need. But as you heard the president say, no national curfew at this time or anything of that measure. The president also praising companies that have stepped up to help with the effort to make sure supplies are getting out there. But the big question also for the White House is what kind of aid package is going to come next and what people should do that are struggling with work. We asked the president about that, or the lack of work for that matter, moments ago as well.
Right. Well, what they do right now is keep receiving their paycheck, and hopefully their companies are going to be in a very strong position. We want to keep everything together because we think we're going to have a tremendous bounce back.
However, it is unclear exactly when that bounce back may happen. We also know that members of Congress have been meeting with the administration, members of the Senate, to try to come up with what an aid package may look like. We've seen a few numbers tossed around between $1 to $2 trillion. But as the House and the Senate get ready to debate this, there are still a lot of questions about how this will work for those people that right now are very worried about paying their rent, paying their mortgages, and where that paycheck is going to come. A lot of people wanting to hear what's going to happen next on that.
And also, Mark, there are some leaders, mayors in local cities and governors and states wondering what should they do? Should they put the entire city on lockdown, if you will? So maybe you can find out if and when the federal government, the president, will actually, in fact, order a national mandate. He seems to be